In 1990, he was diagnosed with kidney failure, and they assumed the kidney failure was as a result of a car accident that he had had in 1975 when he was 17, and we're having as normal life as possible. Then in 2002, his health started to deteriorate. In March of 2008, his kidneys deteriorated rapidly and he had to go on dialysis. They discovered he had cancer. It was already stage 4, and his oncologist basically said, with treatment, radiation and chemo, that Trevor most likely will, his demise would be within 2 years or so. He continued dialysis during that time 3 times a week, and lived the rest of his life in and out of hospitals and palliative care and hospice, and until he passed away in February of 2010.
My husband died just over a year ago. He had had type 2 diabetes for over 30 years, and 4.5 years ago went into kidney failure. So we sort of dealt with his really extreme illness from, I would say, 4.5 years ago, and he, as I say, died a year ago in January.
Mm-hmm. It was my husband, Bob, who died February 18th, 2010. He was on dialysis for about 5.5 years. He chose to quit dialysis, but he had broken his wrist, and since he needed a walker, that meant he would be in a home for 6 weeks, and he wasn't going to do that. So he chose to quit, and he died within 6 days of quitting dialysis at home.
When he got to the hospital, the doctor gave him the choice. You know, you probably won't get out of the hospital. Do you want us to treat you? And he said, well, I guess they have to. And he said, no, you don't have to. But he decided that he would. The first couple of days he was in the hospital, he was very agitated. The third day I went to see him, and he was very calm. Very calm. He was just watching TV as he loved to do. I sat on the side of his bed and chatted with him and talked about, you know, all the good times we had going camping and different things that we would do together. And he went out of the room, and I didn't see him again after that. He passed away in his sleep that night.
It's perfectly normal to see the struggle. This is a difficult issue to deal with. Not everyone's going to be on the same page. But I do have a belief that every person has a right to discuss or prepare or cope with end-of-life issues. And everyone's going to take their own journey in getting there.
We discussed the fact that he potentially could refuse dialysis, that was a choice that he had. And we talked about that, but he felt very strongly that that wasn't an option that he wanted to take. So even the day before he died, we did go to dialysis.
The biggest decision we had to make was, if it came to a choice of whether we were going to allow the cancer to be the cause of his demise, or whether we would take him off dialysis and let that take his course.
A lot of our patients do carry this guilt and this fear that if I stop this, if I can't carry on, then I am breaking that vow and that promise I made to you. And the underlying emotion that's associated with that is phenomenal. And the fear of what you might be causing your loved one by bringing up this conversation often leads our patients to just avoiding the situation altogether. And so because of that, some of our patients, they might continue on with the treatment that they feel isn't benefiting them anymore, or they might continue on with a treatment that they've in all honesty grown tired of because they don't want to put their loved one in that situation where they might suffer. And if you look at the definition of love, that's probably one of the greatest definitions right there. But the personal sacrifice that's associated with that is sometimes too much.
I would hear him kind of muse out loud, well, maybe I'll stop going to dialysis. And I'd find, we'd be watching TV and I'd say, well, Dad, you always have that choice. And we'd watch a little bit longer and it would always be the same. Well, no, I can't really do that. No, I've got to keep on. There was never any doubt in my mind that he would not choose to stop dialysis. Yeah. I knew he never would make that choice.
Patient might have made a clear decision that they're ready for the end of life, they're prepared, but other family members aren't. And when I think of the renal journey, it's a little different perhaps than some others, in the sense that there are so many ups and downs, so many times when they may be nearing end of life or had brushes with death, but they were brushes. And so again, as I say, it's that roller coaster, and the family, that's their normal. And so when a person says, you know what, I'm thinking about discontinuing dialysis, for example, the family's not sure. Is this one more of those down periods? Is a person depressed, for example? And so it's those kinds of struggles that maybe I'll be coming into the conversations with them.
I don't remember once one of us saying, are you going to quit or I'm going to quit? It just seemed to be a part of the conversation for a while. And knowing that we were going to do it that way, we had talked to his nephrologist and a palliative care nephrologist to find out what happens during the process if you choose to quit. Like, how long does it take, and is there pain, and what can we do?
What I found was that I was taking on a sort of a provider role for him, like he did when we were infants and weren't able to look after ourselves, and that was it was actually quite satisfying for me to be able to do that.
When you get ill, you have a sort of erosion of your control in your life. You slowly lose all the control, right down to where somebody's bathing you and doing things for you that you hadn't ever probably thought that they were going to have to do. And so I thought it was really important, partly that I be involved with most of his care, because he found that a lot easier to deal with if it was me.
And Trevor said at that meeting, anybody can take care of me, but I need my wife to be a wife. And this is why I want to stay at this hospice. I want my wife. And that's when I realized that I'm going to focus so much on his care and making sure that everything was so perfect for him, like I always had, that I was missing out on just being his wife, and that was so important. And I started at that point changing my attitude.
I've learned to just listen, and listen really carefully to what they're not saying, and try very hard to keep my thoughts and my feelings in check, and just hear what they're having to say. Because sometimes it might not be that they actually are thinking of end of life right now, but they want to know what it looks like. It's the fear of the unknown, I think, is the most scary thing for anyone.
Through the whole illness, my focus was making sure he was comfortable and making sure I was his strongest advocate, because he got so tired and weak that he wasn't able to speak for himself. And he never complained. You have to be very careful not to treat your loved one as a patient. Like, they get enough of that from everybody else. So I really was careful not to talk to him like that, not to, he was still always my husband, and that's the way he needed that.
Regardless of what our particular role is, whether it's as a social worker, a nurse, even nephrologists. I think the key piece is to be a good listener. Listen to what the person is saying. What do they need right now? Not to go in with my own agenda, parachute in, I'm going to tell you what you need, but really to listen and say, okay, what does this individual, this is their personal journey. So it's not everybody does death the same way. They don't, right? So it's really to listen to where do they need to go in their personal journey and the end of life.
In the last few weeks of dialysis, where the dialysis wasn't helping, and I knew that we weren't prolonging his life, we were basically prolonging his death. He was in so much agony, and I could do nothing to help him. And I used to say to him, what can I do? What can I do to help you? How can I take this away from you? And he would say, you're here, you're beside me, you're helping so much, and I never thought I helped enough. I wanted this magic wand that I never had.
I would encourage people, I think, to discuss every aspect of what was going on, because patients, I think, do feel that they're losing control, that they need to be kept in the loop of discussion about their care, and they need to feel that their wishes are sort of the ultimate.
Count on your friends and family, that's for sure. Call them, talk to them, take walks, take a break, go for coffee. Didn't matter how stressful it got in that hospital room, you know, just if it got to me, I'd just get out of there and go have a quick walk or something and come back and feel better. I tried really hard not to break down in front of Bob, and he never broke down in front of me, just once, over pain. So, in hindsight, I don't think I would change that, you know. I don't think he needed to see or worry about me. I got a really good piece of advice from someone who had lost her husband a year or so earlier. And she said to me, accept every invitation. I don't care if it's the day after he dies, because it'll get you right back into normal living as quickly as possible. And the worst that can happen is that you'll have a bad time.
People a lot of times don't come forward because they don't know what to say and they don't know what to do, and they're just sitting waiting to help you, because they don't know what to do for you. And the minute you even make the slightest hint, they're there for you. You know, and I think it's really important that we ask for help. We ask for help from friends, we ask for help from nurses, we ask for help from everybody who's in our life. And because in the end, we need this support, and that's what gives us strength.
I think we both were grateful to each other. I valued him enormously.
I know he gave me 2 years more than he should have, and I'm grateful for that, because his quality of life was terrible, you know, so I couldn't complain. And how many people get to choose when and where you're going to die, so that was a gift.
I consider everything that's happened such a blessing in my life, and I just want to pass it on. I know what was said to me, the encouragement, the inspiration, the support that was given to me is just invaluable. In fact, I say to myself, and I've expressed this to many people, I feel like a multi-billionaire in the things that money just cannot buy. And if I can help somebody, bring them comfort, bring them some strength, and just even give 1% of what has been given to me and was given to my husband Trevor during all of this, you know, I know it'll really help them.
All those years of mental preparation, knowing you were leaving day by day, unsteady swimming in a quiet desperation, hoping against hope that you would stay. Always a chance for something unexpected. Some small thing to make you still believe. With you nearby, somehow I felt protected. How was I supposed to let you leave? I often wondered what you waited for. Forgiveness or a